2020 has been an eventful year, to say the least. First with the ongoing coronavirus pandemic, and now with protests happening worldwide and here at home. Joining us now to discuss the intersection of these two major events is President and CEO of Dignity Health Sierra Nevada Memorial Hospital, Dr. Brian Evans. Welcome back, Dr. Evans. How are you? Well, when we think about a protest, health concerns aren't necessarily at the forefront. But with COVID-19, there's still a very real threat. Everyone's wondering what effect these gatherings and demonstrations will have on rates of infection. We see some people out there with masks, but regardless, we are certainly seeing a lack of social distancing. Do you expect to see a spike in coronavirus cases?
Gatherings with large numbers of people in very close proximity, and obviously not doing social distancing that we've been advising. Obviously, COVID-19 has not taken a break, and we're seeing really just unprecedented levels of protest, which we worry is going to cause an increase in the number of cases. And epidemiologists all over the country have been looking at this and making predictions that it probably will increase the rate of spread of COVID-19. A couple of good things about it. Most of these protests are outdoors. A lot of people are wearing masks, actually. When you look at the videos, you look at the pictures, people are wearing masks, but it is very close proximity, so I'm concerned about it. If you look at the number of cases of patients in the hospitals throughout the state of California, we haven't seen a big bump yet. It's been relatively flat, so I think that's fortunate, but I think people are concerned about what's going to happen in the days and weeks to come.
Have you so far seen any immediate effects from the protests at our area hospitals?
Well, for Dignity Health hospitals, not really. We've been relatively flat in the 6 Dignity Health hospitals. Certainly, we haven't seen anything up here at Sierra Nevada Memorial Hospital yet. But it takes a little while for COVID-19 to incubate, and so we wouldn't expect to see an immediate shift on that right away. So we're wondering what's going to happen next.
Yeah, I think we're all kind of waiting to see what the future is going to bring in terms of those COVID cases, if there will be more. Another part of what's currently going on is communities, they're opening back up slowly. Any updates there when we talk about new cases showing up, or is it still too soon to tell?
Well, I think it is a little bit too soon to tell. I went to a restaurant, by the way, last night for the first time in 3 months, and it was surreal, actually, going to a restaurant, and it just seemed like such a novel thing to be doing. We do expect that the re-entry back into normal life is going to cause some increased cases as well. We hope that people are going to take precautions and really be very thoughtful about the decisions that they make. But, again, so far we haven't seen a big jump in the cases. And maybe part of that is due to the weather. We're in the summertime now and it's warmer, and maybe that's helpful. But, we're all sort of watching the numbers very, very closely. We have seen an increase in the number of positive tests in the state of California. So if you track that over time, it's been kind of going up, and we had, but it varies day by day. Part of that, though, may just be the fact that there is more testing capacity in the state of California than we did have about a month ago. And so maybe we're seeing more cases pop up because of that.
When it comes to these businesses, would you say that some of them, are they at higher risk for getting COVID-19 cases?
I think it's a good thing to be thinking about as we, as consumers, want to go back into stores and restaurants and things. You want to think about what businesses are higher risk than others. So being indoors, being in close proximity, when there's loud talking going on, people could potentially spread the virus more easily. So those types of things. And then the duration of time. So when you think about, if you're in a restaurant, I went to a restaurant last night, I was outside. And so outside is ideal if you're out on a patio, and if the tables are separated by a distance of at least 6 feet, ideally even more than that, and if people are wearing masks on their way in and out of their restaurant so they're not contaminating each other. And then you want to bring, your hand spray and all that kind of stuff, or just wash your hands to make sure that you're being safe as possible. So any kind of businesses where you're really in very close proximity and for a long period of time. And then I also worry about places of worship where they're singing or loud talking and large crowds. I think that those are concerning situations. We really just have to mitigate those risks as much as possible.
Yeah, when we talk about kids, we've talked about kids being a little less prone to being affected by COVID. Is that still true? What's the current risk for them?
Well, when we started seeing COVID pop up, originally it looked like kids were really less affected, significantly less affected, and that's still the case. The children are much less affected by COVID, but there's a real big caveat to that. We have seen some children get extremely ill from COVID-19, and we've seen this inflammatory condition, multi-system inflammatory syndrome in children, which has been significant illness for some. And even in New York City, there were, I think, close to 200 cases of this. And children can become very, very ill, and they can die from this condition. Fortunately, we haven't seen a lot of that by comparison to the number of adults that have actually gotten sick from COVID-19. But I think it's something to be very concerned about as we open up the schools and we start to see, more contact with children. We may see more cases of that pop up. And so I think that scientists are really looking at what they can do to treat that, to prevent that, because it's a terrifying ordeal for children and their parents when that pops up.
Yes, I know. We'll definitely continue to keep an eye on our children as we are with everyone with any possible symptoms. What about treatment options? What's the latest there? Is there anything out there that we know will help prevent coronavirus?
There's so much research going on right now. I mean, you have to read the news every day. You have to follow what's going on in research every single day just to stay current. And scientists are really pouring a lot of energy and resources into this. Right now, there aren't fantastic treatments. I think we talked previously about remdesivir, which is an antiviral medication, and there's a lot of research going into remdesivir. It does appear that it has some benefit for hospitalized patients, but it is no miracle cure. It's not like, it's just going to eradicate COVID-19. What it does do, though, it appears to shorten the course of symptoms somewhat, and patients do a little bit better on remdesivir in the hospital than they otherwise would have. That's the preliminary data, more to come. One other thing that there's a lot of promise for this is plasma therapies, convalescent plasma therapy. And as you know, Aubrey, if somebody gets sick from COVID-19, their body will make antibodies to it. And if they recover, those antibodies stick around. So you can take blood out of one of those patients, separate out the plasma, and take those antibodies and use those to treat someone else. That treatment is showing some promise, very preliminary, and we don't have a large trial yet to hang our hat on, but I think it looks good that could be a helpful treatment. And then there's other things like vitamin D, which I think there's some evidence that people should make sure that they have adequate vitamin D levels. Certainly people with vitamin D deficiency ought to know about that and do something about that and probably take a supplement and maybe get some sunshine.
All right, Dr. Evans, thank you so much with your insights and your updates regarding health and medical concerns in COVID-19.
Thank you, Aubrey.
This interview involves commercial content. The products and services featured appear as paid advertising.